Hello, welcome back to our 2017 Educational Webinar Series. I'm Dr. Jill Brooks, Senior Director of Education for First Healthcare Compliance. At First Healthcare Compliance, we help you with a comprehensive compliance management solution tailored to your business, a hospital network, healthcare practice of any size, billing company, or skilled nursing facility. As part of our complimentary educational webinar series, we bring you experts from around the country to discuss relevant topics in the healthcare industry. We are so pleased today to have Dianne Pledgie, Feldesman, Tucker, Leifer, and Fidell presenting Corporate Compliance for Federally Qualified Health Centers in 2017. As Compliance Counsel with the firm's Health Law Practice Group, Dianne assists health centers with the design and implementation of effective compliance programs focusing on their highest risks by conducting risk assessments, developing targeted compliance work plans, and coaching compliance officers throughout the process. She also conducts trainings across the country on building compliance programs that engage the entire organization, from the board of directors to frontline employees within the compliance program. Dianne is well versed in the compliance issues facing health centers because of her experience as Chief Compliance Officer and Manager of Government Grants for Boston Healthcare for the Homeless Program, one of the largest health center programs in the country. She implemented a compliance program which addressed federal and state grant requirements, the FTCA and risk management activities, and HIPAA and state privacy requirements. She led internal investigations, oversaw internal and external audits, developed internal policies and procedures, and conducted annual and new employee training. Dianne currently serves as the Interim Compliance and Privacy Officer with a large multi-site health center in Washington, D.C. In addition, she is an editor and contributing author to the National Council for Community Behavioral Healthcare's Compliance Watch newsletter. She also researches and writes in-depth articles on various compliance topics, produces the firm's Compliance newsletter, and drafts sample policies and procedures. As the first point of contact for health centers with compliance questions, Dianne is always ready to guide clients to the resources they would need. A copy of her slides are available for download on the control panel. Feel free to submit questions into the question box on your control panel during the presentation. We will address them at the end. Your Paycom CEU certificate will be emailed to you from Paycom following the broadcast within 48 hours. There's no need to request your certificate. Additional CEU opportunities will be available to BC Advantage members following the live broadcast. See their website for details. Dianne, go ahead.
Thanks, Dr. Brooks, and thanks to everyone out there in webinar land for joining either this afternoon or this late morning. I'm delighted to be with you. As you heard from my resume, this is what I do on a regular basis. So it's always great to chat with others who are currently a federally qualified health center or considering becoming a federally qualified health center and thinking through what compliance means for us as health centers. So along with hearing everything about me, you now know what I look like and you know that I'm excited to be here with you all. So for the webinar today, I figured we'd start out by talking about sort of the universe of risks for health centers, then talked through several of the specific regulatory compliance issues for health centers, then talk about what the OIG is paying attention to related to health centers, and then some thoughts about how to build a compliance program in your health center which helps to identify and then address some of these risks. So as my 8-year-old nephew would tell you, the universe is huge and it's full of amazing things. And so for health centers, our risk universe is huge and it's full of amazing things because we as health centers have specific regulatory risks, which I'll talk about for a little bit this afternoon, related to having received our Section 330 funding from the federal government. And we have other regulatory risks too, if we receive funding from other state and federal agencies. So we have those risks that are really unique to us as health centers and which often take up a lot of our time and energy, and then we sort of forget about these other pieces that we need to be paying attention to when we're thinking about developing a really comprehensive compliance program for our health centers. So one that's directly related to the fact that we get federal grants or are part of a federal contract is how we manage those. And so one of the big risks for health centers out there is how are we managing our federal grants? And this is something that HRSA pays attention to and the OIG definitely pays attention to. And so I'll go over some of the places where health centers in the last year or so have had some issues come up in their reviews by the Office of the Inspector General, specifically around how are they managing those federal funds that come to them. Do they have the tracking in place that they need to? Are they meeting what they say they're going to do in their grant applications? How are they reporting back to the funding agency? So that's a big area of risk for health centers. We have a similar legal liability as others in the healthcare arena. So fraud, waste, and abuse is a huge area of risk for health centers. We submit bills just like other healthcare providers, and so whether we're billing Medicaid and Medicare or private insurance, we need to be aware of and paying attention to the laws that affect that, the False Claims Act, all of that, just because we're doing good work as health centers, and we may have some different ways that we help provide care for our patients with a sliding fee scale and things like that, doesn't mean that those other rules and requirements don't apply to us. I think that with health centers, we often think, and having come from a Healthcare for the Homeless program in Boston, that started as a very small program and is now a multi-million-dollar organization, we sometimes think, oh, we're just these little guys swimming in the pond. But when you start looking at how much we're billing Medicaid and Medicare, and you look at how many providers we have on staff and things like that, all of a sudden we become targets for similar audits and having the government pay attention to us. And we have similar liability around our tax status and maintaining it. We also have HIPAA and other state privacy and security requirements to pay attention to. So we have all the same legal liability as others in the healthcare field, including clinical risks. So how are we credentialing our providers? How are we credentialing providers with insurers? And how are we credentialing for our health center requirements as well? And we have requirements around quality assurance and making sure that we're tracking that comes from both our federal grant funding and from other outside organizations. And in case your blood pressure is not yet high enough, we have all of these other risks that come into play when we think about what are the compliance risks for health centers. So these operational risks. We have OSHA issues to be concerned about and paying attention to. We have to meet the emergency planning requirements under Medicare and Medicaid. We have human resources issues, patient grievances, making sure our patients are being provided with the right services if they have limited English proficiency or disabilities as required under Section 1557. So usually at this point in the presentation, my stomach starts to hurt a little bit and other people start to get that nervous panic look on their face as well. And so I think part of what we try to do is say, okay, all of this applies to us as health centers, and the Office of the Inspector General is going to want us to be thinking about these risks and how they actually affect us, because we might as a health center have a lot of things in place that protect us from some of these risk areas, but there might be other areas of risk here in this list where in the back of your head you're thinking, oh, I'm not really sure what we do about that. I'm not really sure what we're doing around time and effort reporting related to our federal grants. So maybe we should put that in a policy or procedure. And that's why a compliance program that follows the OIG's 7 elements can be really helpful for health centers. So before we talk about that, let's talk through some of these regulatory risks that are special to us as health centers. So as a federally qualified health center, we get a lot of great benefits. We get the ability to bill at our FQHC rate, which is hugely important for us so that we can see our patients and keep our organizations afloat. We get access to the FTCA coverage, our malpractice coverage that comes from the federal government. And as health centers, we also get access to the 340B drug discount program. So I'll spend some time now talking through each of these and sort of how compliance is monitored in each of these regulatory areas. Noting, of course, that depending if you're getting funding from other federal funders, there are other pieces that would come in as regulatory risks for your specific organization. So if you are new to the world of FQHCs, welcome. If you are like me and have been kicking around in this world for a while, then this slide will be sort of review for you. But as health centers, we are tasked with providing care to communities that need us most. And with providing that care, we are held to certain program requirements, which HRSA calls the 19 program requirements. So you'll hear HRSA talk about that a lot. HRSA being the funding agency through the Department of Health and Human Services that we receive our grant funds from. So the Health Resources Service Administration provides us our direct funding as a federally qualified health center, and as part of that funding application and setting up a health center, we're focused on the HRSA's 19 program requirements, which require things of us that are in our statute, such as providing services to patients regardless of their ability to pay, how our governing boards are set up, how we need to be in touch and doing a needs assessment based upon our community. All of these pieces are part of the 19 requirements for health centers. So when you first apply for federal funding, you go through the application process and you submit a lengthy proposal which talks about how your organization meets these 19 requirements, all the attachments and amendments and all of those pieces. And then once you're funded, HRSA will monitor compliance on a regular basis, and they do that typically through two ways. One is your reapplication for that federal funding, which now happens every 3 years. And then in between that written application period, HRSA is doing operational site visits. So it's about every 18 months that you would have a compliance check-in. If we think of reapplying for your grant as a compliance check-in and then an operational site visit as a compliance check-in. And the operational site visits were launched a couple of years ago, sort of relaunched and much more targeted than they had been in the past. And that's because HRSA actually was monitored by the Office of the Inspector General, who said you need to be providing more support to your health centers around the program requirements, making sure that they're meeting these 19 requirements, explicitly telling them what's required as part of each of these requirements. So HRSA launched this new operational site visit. There's the operational site visit guide, which was published in 2014 and which is available on HRSA's website, which is sort of our go-to place in prepping health centers for their site visit. And then we started to see reports coming out of the operational site visits. And so on the next slide, I sort of highlight some of what we're seeing as the top compliance risk areas coming out of those operational site visits. Our clients are health centers, and so we help them to prepare for these, and then we help them to clean up afterwards if there are issues. And we hear from them a lot around what are the main pieces that are being targeted in the operational site visits. Now, because there's 19 requirements, it is very hard to get 19 out of 19 on your operational site visit report, and so if you have done that, congratulations. Typically, we see health centers coming out of their operational site visits with between 3 and 5 not met around the program requirements. And so in the report, it will articulate that for you, and your health center will go through a process in order to meet those requirements. But where we're seeing health centers have the most issues during those operational site visits in the area of services, and I put here the program requirement number, so you can go back and look at it and see what is specifically required under there. But site visit teams are finding issues around the scope of project. So health centers need to maintain an accurate and up-to-date scope of project, meaning all of your forms, Form 5, A, B, and C need to be up to date. Where are you providing services? Who's providing those services? At what hours? What types of services? Are you providing it directly? Are you providing it under a contract? So making sure all of those pieces are up to date and that the board has reviewed and approved certain pieces of that. So things like the needs assessment, Service area and target population, that the board is reviewing and approving all your health center sites and services and locations, and that they're actually approving also your grant applications, and that you can show that to the reviewers in board minutes, that it's clearly reflected there. Also in services, health centers have struggled around making sure that they can demonstrate to the reviewers that they are providing all of the required and additional services that are required under federal funding. So making sure the mix and level of services reflects what's needed in your community. Reviewers will ask when the last needs assessment was done and a strategic plan, and how are you showing you're lining up to meet those needs in your community, which is part of why we are funded to do what we do. And also here making sure that contract service arrangements, hospitalization and referral arrangements are all formalized and compliant with the requirements for HRSA. As far as management and finance findings coming out of operational site visits, the sliding fee discount program continues to be a challenge to implement for many health centers. So this is how health centers provide patients with access to care on a sliding fee. And so there is a lot of detail on this on HRSA's website, and you can of course read the sliding fee scale PIN, but making sure that that fee schedule is appropriately structured, that there's a process in place to verify patient income and family size in order to determine the eligibility for the sliding fee scale, and that those are the two elements that are used to determine eligibility, that there are billing and collection policies in place, that the governing board is regularly reviewing the sliding fee discount policy and your levels each year, that schedule of discounts has to be evaluated to make sure it meets the discount level requirements under the federal poverty level. So we see a lot around that, and way more than could possibly be covered in the presentation this afternoon, but we do see health centers continuing to struggle with a sliding fee discount coming out of their operational site visits. So certainly spend some time with PIN 2014-02 to make sure that you have established and implemented a fee schedule and sliding fee discount schedule that meets the requirements under that PIN. For those new to federally qualified health center lingo, or considering becoming a federally qualified health center or partnering with one, HRSA puts out guidance to us as grantees through PINs and PALs, program information notices and program letters, and that's how we determine how we're supposed to implement some of the 19 requirements. And so the sliding fee discount had a new PIN come out in 2014, and we're still seeing that being implemented by health centers, and the operational site visit reports showing that's a high area of risk for health centers. If you are prepping for your operational site visit, certainly spend time making sure your health center is in good shape there. Also around collaborations and affiliations with those in your community, and also those with whom you are referring or referring to, making sure that those are structured appropriately. Site visit teams often find issues around financial management and control policies to make sure that you have the policies in place around to prevent fraud, waste, and abuse. Make sure you have up-to-date grants management policies and procedures as required under the super circular. Lots of times health centers have budget issues coming or receive a not met around their budget in their site visits, and so making sure that that health center budget is regularly reviewed with monthly reports, making sure that the board is aware of that the board approves the budget, things like that. And then finally, in the section of governance related to 330 regulatory requirements, the board does the board have the appropriate authority, and are they acting under their authority? Making sure that your bylaws are up to date with the required provisions in PIN 2014-01, as well as looking at that site visit guide. Is the board meeting monthly? is the board approving those documents and policies and procedures that need that level of approval, and can you document that in the minutes where the board did approve certain documents, and are they provided with regular training to make sure they understand what their requirements are under Section 330. Also, the board composition, ensuring that your board meets the Section 330 requirements as far as the number of members and also the number of consumers, representation of special populations, and the percentage of board members that can derive their annual income from the healthcare industry, making sure you're meeting all of those pieces. And then finally, the conflict of interest policy, that your health center has one in place, that the board is aware of it, that it's board approved, that board members sign a disclosure statement, as well as those that are part of the health center are signing a disclosure statement or making a disclosure on a regular basis. Operational site visit teams will be looking for all of that if you're prepping for your site visit, and also as you're prepping your grant application, your next application, then you'll be looking to demonstrate all of those, of course, all of the 19 requirements, but just what we are seeing as far as the top trends in compliance around 330 funding. So as you may know, HRSA did release a draft program compliance manual last August, in which they consolidated certain PINs, PALs, and other guidance, and sort of they put this out to the field as a draft for reaction from the world. And so they've consolidated a lot of pieces. They've changed things that have been long-standing policies in the PINs and PALs. And so the last we saw was that it came out in draft in August, and there was a comment period during which Feldesman Tucker, as counsel for the National Association of Community Health Centers, certainly provided some comments back to HRSA about the changes that we saw under this draft program compliance manual. And now we're waiting. And we continue to wait. And I don't have any particular insights for you as far as when this will be released and finalized. We do know that HRSA has all of the comments. We do know there's been a change in administration, so we don't know how that will affect it. We do know that in the past, when HRSA, or the Bureau of Primary Health Care, has put out drafts, PINs or PALs or other guidance to the field where they've gone through this similar process, they have taken those comments and then made changes when they release the final document. So if you are expecting an operational site visit anytime in the near future, until HRSA releases the final version of their program compliance manual, you would look to the site visit guide from 2014, because that has been finalized. What was drafted in this draft program compliance manual is draft. And so we advise not to rely on it, because it could change quite a bit if and when HRSA finally releases the final version of it. And we will certainly be paying attention to that, and let those in the field know when we know more about that. So the other benefit that comes from being or one of the benefits that comes from being a federally qualified health center is that health centers can take advantage of protection under the Federal Tort Claim Act. And so this was offered as a way to help health centers spend their grant dollars providing to the community and not defending against malpractice claims. So to the degree that a health center is deemed by the FTCA program, then it provides immunity from lawsuits, from malpractice lawsuits for health centers, so long as the service is provided as required under this 330 funding. So if a patient were to make a claim against your health center and say that your doctor had provided or had committed malpractice in the care provided, instead of the health center paying the lawyer's bills and defending that, the United States government steps in and says that for purposes of this transaction, of this case, the health center is like the United States government. the employees are deemed like they are United States government employees, and so the federal government will step in and defend that case for the health center. So this is a special benefit for Section 330 grantees. Compliance for this is checked through your annual redeeming application, as well as HRSA launching FTCA site visits. So each year, I remember this so well as the manager of government grants, you are required to submit a deeming application in which you answer many questions about what your health center is doing, related to policies and procedures, trainings, peer review, all sorts of, the quality plan, things like that. So that is submitted to the government for review, and then you are deemed for the next year to be covered by the FTCA. So that happens each year, and then HRSA has instituted site visits for the FTCA as well. And based upon guidance from HRSA, an FTCA site visit appears to be able to happen for any reason or no reason at all. They're sort of vague about exactly what will prompt it. Certainly, if in your deeming application you're reporting a lot of malpractice claims, or something looks out of sorts in your application, things like that will likely put you at the top of the list. But there's no sort of regular FTCA on-site site visit happening like we have for your regular 330 funding. We know those HRSA operational site visits are supposed to happen every year and a half into your grant period. The FTCA site visits, there's not sort of that same regularity. So they can, HRSA will let you know that they're coming for an FTCA site visit. You'll have some amount of time to prepare for it. The results of their reporting and their evaluation is not to affect the current deeming status. However, it could affect the following year's deeming cycle. And so I've listed here, just so you have them, some of the common findings that are coming out of the operational site, or the FTCA site visits, which we see happening more regularly with our clients, or our clients are letting us know that these are happening, and looking for sort of guidance around them. So you will have some notice in order to get things in shape. If you have not had a site visit around the FTCA or concerned about it, I would certainly use your next deeming application, which should be coming out soon, as an opportunity to really look critically at your FTC application to make sure you have all the documentation to show that you are doing what you are doing, you have the policies and procedures in place that you say you have, that they're fully implemented in your health center, folks understand them, because when they come on site, the FTCA on site visit will be a couple of days long, similar to the operational site visit, and they'll talk with folks throughout your organization to see what's on paper, and then also how is it operationalized. And so I'll leave these for you all to go through. You'll note that they, it tracks what's in the application, your deeming application. So they really are testing, are you doing what you say you do in your application each year to us? Are you showing us that you're actually implementing this program the way we expect you to? And finally, as far as regulatory risks, as a federally qualified health center, we have the opportunity to take advantage of the 340B drug discount program. Many health centers take advantage of this, not all do. It does require quite a bit of oversight from the compliance perspective, because under the 340B discount, the compliance responsibility remains with us as the covered entity. It is the health center's burden to make sure that compliance is maintained, regardless of if you're contracting out with a Walgreens, CVS, somebody else. You still have that responsibility to make sure that the program runs in compliance. And so 340B drug discount program is a program by which drug manufacturers who want to participate in Medicaid, they want the dollars that come from Medicaid, agree to provide outpatient drugs to certain covered entities at reduced prices. And then those covered entities can use those drugs in their program in filling prescriptions for their patients, and can use that funding, that money that comes in from there, in furtherance of their grant and their other activities. So we at health centers are covered entities, for 340B purposes, as are Ryan White programs, and so we see a lot of those folks as our clients here, but also these disproportionate share hospitals, so DISH hospitals, and they are also eligible for 340B. There's been a lot of attention paid to the 340B program, actually starting back in 2011, where the GAO issued a report to Congress, and since then there's been a lot of folks on Capitol Hill paying attention to this program because of how they view the benefits of the program and whether they're accruing to the right types of organizations if it's going to a big hospital. Congress gets very concerned about whether that's the right place for the benefits to accrue. And so we are now required to do annual recertification of our 340B program, and surprise, and they're also now targeted and random audits as a way to make sure that you're maintaining compliance. So there's this recertification process, and then also random audits are happening. Those audits are all available online. You can find them. I think we have a slide on it. We do. And you will see that as part of the uptick in there, we're seeing a higher percentage of FQHCs showing up in the pools that are audited. Many have findings. You can go online and read sort of what's happened with them. We see a lot of issues around, these are the big compliance pieces here for the regulatory pieces around making sure that the drugs are provided to patients of the health center by a provider that has an affiliation with the health center, where you have contract pharmacies who are helping to implement the program, that there's the right documentation in place, making sure that there are not duplicate discounts, whereby the drug has already been provided at a discount to the state, and then there's another discount on top of that. All of this goes to show that having a robust 340B compliance program in place is very important, again, because the responsibility for it lies with your federally qualified health center. So just a few minutes, I'll spend talking about the OIG work plan and what is in the current work plan that's most relevant for us as health centers, so what we're paying attention to. But a note on the OIG. And this is not meant to in a mean way at all. The OIG cares about what the OIG cares about. So they care that the funds from HHS are spent in the way they're supposed to be spent. So the OIG cares a lot about Medicare and Medicaid funding. They care a lot about the grants that we receive. They don't care about some of our other risk areas as health centers. So the OIG is not going to be looking into HIPAA violations at your health center. So we're not going to find a lot of guidance by going to the OIG work plan on that. We're going to find a lot of guidance around Medicare and Medicaid and grant issues and things like that, but it's not going to be the whole universe of everything that needs to be part of your health center's compliance work plan. So the OIG, it's a great investment. I mean, I would put my retirement funds somewhat in this return. It's not too bad, through their efforts as far as investigating and doing reports and all of that. They make a good case for themselves and for continuing to do what they do, and that's through finding fraud and abuse in the system and making sure that it's returned to the taxpayers. So each year HHS puts out their work plan, and for the last couple of years it's come out in the fall. And in it, they talk about what they did last year and then what they're working on in the year coming, and sometimes they talk about some other things they're thinking about doing in the future. So when I look at the OIG work plan each year, I look in two big places for health centers. First, I look to see what's happening, what the OIG has done and is going to do around public health and human service reviews, because that's where you'll usually find the HRSA piece. And then I also look to see what they're talking about in Medicare and Medicaid and try to figure out what's most important for us as health centers. Of course, you all participate in a whole lot of different projects and programs and have different types of funding and things going on. So you're going to want to look at the whole work plan just to make sure, there may be something in there that you guys do as an outlier, which, wouldn't come up when I'm sort of looking at it generally for all of our clients. So you'll want to look at the whole work plan just to make sure they're not, launching some review into this special project that you all work on. But when I look at the Public Health and Human Services reviews, the reason to look there is because that's where they'll talk about HRSA, they'll talk about the Indian Health Services, they'll talk about SAMHSA, and they'll talk about other public health related reviews that have been happening or that they are planning to do. So this is sort of the big focus for us as health centers when we're trying to figure out what's the OIG going to be paying attention to. And what they have paid attention to in the past is grant funding around the Affordable Care Act. And so 2 bullets here with the citations for 2016 reviews that they did of health centers, and then also a bullet here around 340B. So you can go and look up more details on all of these, of course, but I did just sort of pull some of the highlights from these. It's, this is out there in the world, so I'm not revealing anything about anyone. Hidalgo Medical Services review came out in 2016. They had submitted a grant application for $8.7 million under the Affordable Care Act. They were to construct, build a new health center and a senior wellness center. They had some changes from the time they submitted their application, and so then they amended their grant application, and then they predicted that they would provide care for 350 patients through the Senior Wellness Center, and they also predicted they would create 13 full-time employee positions. So that didn't happen. In the 2 years since the construction was completed, they served 9 patients, or they reported serving 9 patients, and they had only hired 1 full-time equivalent employee. It's actually less than 1 full-time equivalent employee, and they weren't providing the sort of services to the community that they said they were going to be providing. So the OIG review had findings related to they not meeting what they said they were going to do in their grant application or even in their amended grant. They found that Hidalgo had inadequate financial management systems in place, so they were not tracking the federal funds that came in and the federal funds that went out in the way that they were supposed to. They didn't have those internal accounting procedures. The grants management stuff that we need to worry about as a compliance risk area was not in place with their current systems. They didn't have equipment records for some items that they had bought, and they hadn't used a competitive bidding process, which was required under the federal grants management requirements. So the recommendation from the OIG to HRSA was that this grantee should be required to refund $897,000 or sell off the property and then use those funds to reimburse the federal government. And also the OIG said, hey, we need to provide some more, HRSA, you need to provide more support to your grantee in this place. Also noted on here that in the report, though it wasn't an official finding, the OIG said there was no board approval for your grant submission. They couldn't find it when they went on site. So that's very typical of what we've seen for health centers in OIG reviews. Similar for HPM Foundation, you have the citation and you can sort of read about what happened. The highlight here, I would recommend that you pull those reports if you are new to this world or not aware that those have been in place, so you can see line by line what the OIG is identifying as far as issues. The OIG is also paying attention to 340B, and so as a health center who provides 340B and participates in 340B, then we would also recommend that you are paying attention to what the OIG is paying attention to as far as how rebates are happening in the 340B drug program. I know I don't want to spend too much time on that, but wanted to give you guys an overview of what's happening around what has happened in 2016. And then in the 2017 work plan, the OIG has said they're going to be monitoring HRSA and how HRSA provides support to vulnerable health center grantees. And it all flows downhill. So if the OIG is paying attention to HRSA, that means that HRSA will be paying attention to us. And so we will be looking to see what this report says, like how does OIG feel that HRSA has been deficient in monitoring us as health centers, and then what can we expect from HRSA? Probably some more guidance. Probably they're going to finalize that compliance manual. Who knows? But that's what I think we will see in response to that. The OIG is also going to look into funding under the maternal, infant, and early childhood home visiting program. And so states got a lot of money from HRSA for that as part of the Affordable Care Act. Perhaps your state then granted some of that funding to you as a subrecipient. And if so, then you should be paying attention to whatever if your state is getting reviewed. I would take a look at this to just sort of see that you have the practices in place that are identified as requirements there. And then the OIG is continuing to look at health centers who receive funding under the Affordable Care Act. We saw another review come out in early 2017 for a health center in New York. You can find that on the OIG's website. And the OIG is going to be looking at a tribally operated FQHC in 2018, so we'll keep an eye out for those reports. That's the public health side of it. And then the other piece that I mentioned that I pay attention to in the OIG's work plan for my health center clients is I'm always looking to see what's happening with Medicare and Medicaid as it applies to health centers. Got to be a little picky here, got to be a little savvy to know what applies to us as health centers. You know, we're not worried about the inpatient billing, but we are worried about some other things, and we're also trying to think strategically about what might roll down to us and how that might affect us. So in 2016, in both Medicare and Medicaid, there was a lot of attention paid through a couple of reports to how providers are being screened to enter the program, and then what information providers are providing about their ownership, who's on their board, things like that. So, you know, I would look at the entire work plan if I were you to make sure there's not some other pieces that are particularly relevant for you and how you all do business. But as far as generally health centers, when I talk about this, these are the sort of things, you know, we're paying attention to. You know, have you disclosed the ownership interest in your board and the controlling interest that you have to, your list of board of directors, you keep that up to date, because the OIG is making sure states are doing that, and so states are going to be making sure that we as providers are doing that in the world of Medicaid, and who we're providing services to, how sort of the information flows there. With some of these, there's not a lot that we as individual health centers can do, but there are you know, signs sort of flashing that we should be paying attention to. So in 2017, we expect that the OIG will be releasing reports related to Medicare payments for chronic care management, which could be really relevant for us. They're going to be looking at how overpayments have been handled, which could be relevant for us. We can sort of see what the trends are. They're definitely paying attention to delivery system reform in Medicare, also in Medicaid, looking at different billing and payment pieces as well for Medicaid. I'm sorry, for Medicare. And then quickly for Medicaid, you know, there were some reports issued last year. I've provided you the citations here so you can see them as well. Again, making sure that providers are appropriately screened. It seems like there's been a big mixed match of information between what's reported on Medicare and Medicaid forms as well as in the OIG. So my best advice to you is, because you are required to be screening your providers, employees, board members, to make sure that they haven't been excluded or debarred, that you take that and own that and make sure that it's in good shape, so that if an issue is identified, that you can at least say, yes, we did screen all of our providers, yes, we did report everybody who's on our board, and when there was a change in our board, we updated that information, but sort of own that, because that's your responsibility, and we'll see if states get in trouble around that from the OIG reports that are that have come out or that may come out in the future. And so the OIG has also announced some other places where they'll be paying attention to in the next year or so. Again, around dental services for kids, they're really paying a lot of attention there to make sure kids are getting services, and that states are reimbursing them appropriately, providers appropriately for that. And I will leave this for you to read also because we have very little excerpts about what the OIG is doing around these, and so we sort of wait for the reports to come out, but know that this is coming, and these are things that we will be paying attention to going forward. Medicaid also focus for OIG. They also say, okay, in the future we're going to be looking at these types of things, and I don't think there's anything too surprising here. It will be, I think, interesting to see how the final bullet there around mental and behavioral health services is evaluated and how they look at that, especially for health centers who have been providing those services, and healthcare for homeless programs who have requirements to provide those types of services, how they fold into that, or whether they fold into that at all. So in the last 2 minutes here, I'll just sort of talk through, because of our regulatory risks that we've sort of talked about related to 330 funding, we also have a requirement from that same regulation, from the same law, that our health center board of directors make sure that the health center is being operated in compliance with federal, state, and local laws and regulations. So we've always had this as health centers. It's in the actual law that creates health centers. So the board needs to be paying attention to this. So the board should be making sure that there's a compliance program, because they're responsible for maintaining compliance for the organization, or making sure the organization is maintaining compliance. There's also, court decisions that say, hey, the board of directors needs to make sure there's a structure in place where they're hearing about compliance programs and issues. Having this compliance program and a compliance work plan will help to, organize our work around compliance, because that whole big list of worry is a lot unless you put something in place that helps you to address those worries and those risks in a very logical way, identifying top risks and making sure you're working your way through them. And having this compliance program in place helps to demonstrate how seriously the organization does take it. I know quite a few health centers who in their operational site visits have said, okay, here, we do have a compliance program. Thank you for bringing up these other issues. We're going to, have our compliance, our staff compliance committee address these in the next several months. We're going to put it on our work plan. Things like that gives a place for the organization to respond to compliance issues that come up. And so for health centers, like others in the healthcare world, we look to the OIG, and we implement the same 7 elements as other healthcare organizations and entities. And so, we sort of think of ourselves as falling in line here, that having these 7 elements in place will help us to address all those risks. It gives us a place to put those 330 concerns, our FTCA compliance concerns, and our 340B compliance concerns, our fraud, waste, and abuse. All of that can fall into these 7 elements. And so then we know that we're doing regular training on correct coding and billing, because we have that in our compliance work plan. We actually know we have 340B oversight happening because it's in our compliance work plan, and we make sure that the contract pharmacy agreements are reviewed by our legal counsel or our 340B expert on staff. We make sure we're pulling regular reports around diversion and duplicate discounts, and we're monitoring that. And internally, we're taking that on and making it part of our compliance program. Although we are special as health centers, I think we're special. We do have certainly have some special requirements as health centers in this regard as far as setting up your compliance program. We encourage health centers to go about building a compliance program that fits their organization, that implements these 7 elements, having a compliance officer, policies and procedures, a way to assess risk, a way to respond when there's an issue that comes up, that we embrace that and we take that on and make that our own and make that our compliance program. And there are reasons to do it, and to do it in a structure that fits our requirements. So the board requirements around monitoring compliance, they oversee compliance. They can delegate that to maybe a compliance committee of the board, but they hold the organization accountable for compliance, starting with the CEO. The CEO is the one who oversees the compliance officer and makes sure that other staff members are doing their part as far as compliance in their departments. And then the compliance officer is the one who really implements those 7 elements of a compliance program, who's making the reports, keeping the committee organized, developing the work plan with support from other senior leaders, things like that, all good stuff of making the compliance program real for the health center. So I thank you very much for your time this afternoon. I am always happy to talk about sort of the work of compliance at health centers. It is something that certainly keeps me busy and interested. And I think to the degree that, we know where health centers need to worry, we sort of see the trends and what's happening out there and what are becoming high risks for health centers. We're able to put those into a compliance program that helps your organization, and you as either the CEO or the compliance officer or the potential compliance officer, the grants person, puts them into an order which allows you to address those top risks, which is what the federal government wants you to be doing in your compliance programs. It also hopefully will allow you to sleep. And I'm happy for any questions you have this afternoon or even after the webinar. I have put my contact information up there, and Dr. Brooks, I'll hand it over to you in case there are any questions I can answer today.
Great. Dianne, thank you so much. That was a great discussion, and we do have a few questions. When will the HRSA release the final Health Center Program Compliance Manual? And if our site visit is coming up, should we use it to prepare?
So we actually, we don't know when HRSA will release that final, that document in final form. It did come out as a draft in August of 2016. And comments were submitted. So for now, it is a draft document, and we have seen HRSA issue other documents in draft and then make substantial changes to them. So I would not rely upon that compliance program guidance in prepping for your operational site visit. If you are having your OSV, then the Health Center Site Visit Guide from 2014 is still good and what you should be relying on as far as prepping for the site visit. And I would have that out and well marked, and you can march your health center through it as far as preparing, but rely on that 2014 version until we hear further from HRSA. We don't have any, I don't have any particular inside intelligence about when it's going to drop. We will find out likely the same time as everybody else when HRSA puts it up on their website. So until then, rely upon the 2014 Operational Site Visit Guide and the PINs and PALs that are still in place. Okay.
Can we use the Health Center Program Compliance Manual as our compliance plan?
You can use it to help you address, you can use HRSA guidance, so I wouldn't use that again, I wouldn't use that, that draft program compliance manual. I would use the site visit guide from 2014 to figure out top risks, top compliance risks with your 330 funding. But that will not be enough to be a compliance plan that addresses all of your compliance risks, because it's not going to touch Medicare and Medicaid billing, it's not going to touch HIPAA, privacy and security, it's not going to touch those other operational risk areas. So it is not enough. Even if that compliance program manual, if and when that becomes final, it will not be enough to help you understand all of your compliance risks for your health center. You have to look sort of at that whole universe, excuse me, and get information from, other places and put that into your compliance plan to make sure that you're focusing on your top risk areas for your health center.
Okay, and last question, how can we stay on top of the compliance requirements for health centers?
This is a good question. There are a lot of places to pay attention to, and it will depend upon your organization, of course, and where you get funding from and programs that you participate in. But places where I would make sure you are signed up for the newsletter that comes out would certainly be HRSA's site to make sure that you're getting their regular weekly emails that they send out. Similarly with the Office for Civil Rights for HIPAA updates. I would sign up there and pay attention to them. Your state attorney general's office, as far as fraud and abuse and what the state is paying attention to around billing. So if there's some way you can sign up for a list there or be checking their website. Of course, the National Association of Community Health Centers provides information. Feldesman Tucker provides information through NAC, as well as we have a healthcentercompliance.com website. There's a compliance association you could join or be paying attention to. And then just finally, the other thing is to really know your own organization's compliance history. So if you have had an issue around Medicaid billing and it's been identified, then that may need to be your priority as far as what you're paying attention to. And you may be able to let some of these other things wait until the next quarter because you have some major other compliance issue happening, regardless of what's happening out there in the world and who's putting out guidance on all of that. So I think it's important that we pay attention to the outside world as far as cues about what's important, but also look internally and see if there's some other issues that sort of trump what's going on in the outside world and require more attention from your compliance program internally.
All right, well, Dianne, thank you so much. Again, her contact information is there on the screen for any further questions, or if you send us questions, we will forward them on to her. Your Paycom CU certificate will be emailed automatically to you from Paycom. Please join us again next month as we continue our educational webinar series. We're going to be focusing on revenue cycle management. April 4th at noon Eastern Standard Time, optimizing your revenue cycle management, tips on getting the most benefit from your EDI partner with Barb Zalesnik and Kevin Carpenter of eTactics. You can register for this webinar and also request a demo of our compliance solution on our website at 1sthcc.com or call us at 888-543-4778. Thank you so much for your attention and have a great day.